Hey, Dr. Jerry DalCanton here with Dr. Gary Cebeck. Just wanted to do a little video today. We were talking about some of the changes in chiropractic over the last few years. Dr. Cebeck's been in practice for 4 decades, 43 years of practice.
Please don't tell that to everybody.
And he's only 23 years old. He's still fantastic.
It's amazing.
So Dr. Cebeck's one of the finest chiropractors I've ever come across. Amazing with his patients, great hands. His jokes are,
Questionable.
But I was thinking maybe you could just take a couple minutes to tell us some of the changes that you've seen over the last 4 decades. And I think that chiropractic, I think we're heading into a good time period right now. But maybe you could just touch on that a little bit.
Well, it's amazing, Doc. There's been a lot of changes, obviously, 4 decades. There's a lot of changes that occur in every profession. Our profession has evolved in many ways with technology. Of course, the things that go on with technology makes our job more insightful, more accurate, can help the patients get better quicker. Obviously, the documentation today required by certain policies or insurance companies make our job a little bit more difficult, but yet in many ways it helps the patients get better quicker.
Right. I know one of the things that you've utilized over the past 5 years is the laser now.
Mm-hmm.
Do fantastic with that. I think that's a great a tool. I know you've explained to me a little bit before how that works. Can you just talk about what that is?
It's an alternative medical treatment that we've utilized probably about the last 8 or 9 years now. It gives us availability of working with patients and helping some patients that we couldn't help before. Obviously, manipulation therapies, etc., are very, very effective, but there are times when you need to step out of the box a little and work with some protocols or some therapeutic modalities that enlighten us to help people that we couldn't help before.
Right. So, what are some of the conditions that you would treat? Maybe we could send some of our patients over to you too that might be able to help.
Well,
sure. Be able to help them out.
We like to work together. Interprofessional referral is important. We use a lot of laser therapies for conditions that haven't typically responded to traditional care. Disc problems obviously are one of them. See a lot of serious disc problems that haven't responded to typical manipulation. A lot of arthritic conditions with knees and shoulders are helpful here. It can be helpful for many conditions to repair and heal and strengthen the body.
Fantastic. Yeah, I think you've done. I know over the years you've taught me a lot. I appreciate everything you've done for me.
And likewise.
Thank you. And I'm glad you stopped by today and just had a little chat with our audience today. So.
Absolutely. Fine chiropractor here. Go see this man.
Go see.